Hi, welcome to the Recovery Roundup, our monthly exploration of sobriety, community, and well-being. My name is Carrie Dury, and I am the Director of Business Development here at Calvary Healing Center. Today, for this month's episode of the Recovery Roundup, I am joined by our Assistant Clinical Director, Ann Douglas. And Ann, thank you so much for carving out a little bit of time for us today to talk to us. I know you guys are very busy over there, helping all of our patients get better each and every day. But the topic for today that we're going to cover is the importance of trauma therapy, specifically at Calvary Healing Center. Ann's been a part of the Calvary family for longer than I have, quite some time. And so this dates back several years of this type of work being integrated into our model, specifically on the residential side. And, you know, she'll elaborate a little bit more for us. So this has some pretty deep roots at Calvary, which is why I really wanted you as one of our experts here on our staff to talk about it. You are, of course, of course, and help us just kind of give a basic framework for our audience and for those who maybe aren't the clinical side of things, to really just break it down in simplistic terms for folks and let them come to their own conclusions about what this looks like. And in the event that they themselves or know somebody who is struggling, to keep these things in mind when looking for a treatment center, when looking for different options in the community. Maybe these are things that will help folks make that decision later down the road. So again, looking at trauma therapy specifically as it relates to Calvary Healing Center. So I'll kick it off with just a very general question, which is, why is dealing with trauma so important in recovery and that long-term recovery? Why do those two things go hand in hand?
Right. Trauma is a really big topic. So I'm glad that we're talking about this. I think there are some misconceptions about what trauma treatment is and what trauma treatment looks like in early recovery compared to maybe what it will look like with somebody who, let's say, has a couple of years sober, or a patient or a client who does not have substance abuse issues, maybe was just struggling with depression and anxiety and PTSD directly related to trauma. So in this setting, when the patients come in, they're very new in sobriety. Most of them come in either in active withdrawal or in post-acute withdrawal during the first 30 days. So we want to be mindful when we are treating trauma in this sort of setting, and really for anybody in early recovery. Right. Why it is so important and why this is really a long-term treatment is because what we know now that we really didn't know then is that trauma is really the underlying reason for a lot of people who get involved with drugs and alcohol. So we know that now. Years and years ago, when I was in grad school and a lot of us were in training for therapists, the common modality for trauma therapy was cognitive behavioral therapy, so CBT. What we know now is that actually does not work. That does not work alone for trauma therapy. CBT only targets the area in the brain that is responsible for perceiving and processing and thinking. What we know about trauma is that that's actually stored in the body. So trauma is stored in the body. The autonomic nervous system is responsible for that flight-fight system that kicks on in the brain. That flight-fight system is in a different part of the brain than the perceiving and thinking part. Okay, so we really need to tap into that. In early recovery, patients come in and we're basically taking away what they've been using to cope with trauma symptoms if they do have trauma. So we're taking away their drug of choice. We're taking away what they were using to suppress some of their feelings. So suppress the feelings of anxiety and depression. So when we're working with trauma in early recovery, we want to be really, really mindful that a lot is going to come up. Okay. Yeah. So first is the patient needs to get sober. They need to remove the drugs and alcohol from their lives. The second piece is once some stabilization happens, then we can start working on some of the trauma symptoms that may come up. if we don't work on the trauma symptoms in recovery, I believe, and the research shows too, the chances of relapsing are really, really high. Yeah. Because they've been using drugs and alcohol as a way to cope and a way to survive. So when we take this away, the trauma is still there. It's still stored in the body. It hasn't been resolved, and it's actually going to come up more. And we're going to see it more because it's not being suppressed and numbed out by drugs and alcohol. Okay.
Yeah. Excellent, and paints a really great picture and a great foundation for the rest of our conversation. So you mentioned first step, specifically even at a place like Calvary, is this getting a medical detox component complete, moving in, working on some of the underlying trauma. What specific approaches, treatment are we using at Calvary to target some of that trauma, keeping in mind that they're early in their recovery and we only have them typically for up to 30 days?
Correct.
So what
we have a wide array of trauma approaches that we use here. So we have anything from trauma interventions that all the staff is trained on a day-to-day basis. The other word for that is the trauma-informed care approach that we can use with any patient. So if they're experiencing heightened anxiety, or if they're experiencing that fight system kicks on where they have an increased agitation or aggression, we can use de-escalation skills, we can use grounding skills with them. We also have several therapists here that have advanced training in trauma therapy. So we do have EMDR therapists here. We do have an EMDR group. It is part of our breakout groups, we like to call it, where it kind of gives a different taste and a different array of some different modalities that we can use to help trauma patients. We also have a therapist here who's recently been trained in ART. So that's another form of trauma therapy. They're similar. EMDR, traditional EMDR is long-term. So there's 8 phases of it. In this treatment setting, we would just use the first 1 or 2 phases, which is really history, treatment planning around it. And then we look at how they are presenting clinically. And we do a lot of grounding, resourcing, pulling from that strength-based approach, allowing them to have some of the heightened emotions come up, but not too much, because we don't want to overwhelm them this early on. And then grounding them, resourcing them, pulling them back to a strength to kind of calm back down.
Right.
ART is shorter. They can typically have some relief for some depression, anxiety, phobias, and some trauma-related symptoms in 1 to 2 sessions. Can provide some relief with that. And personally, I'm SE trained. I think this is kind of up and coming in the field. It's somatic experiencing. I'm a little biased because that's my background. So I feel like it is highly, highly effective, especially for long term, especially for developmental trauma. So trauma that happened during childhood. Most people have some form of developmental trauma. Basically, some emotional needs were not met during childhood, that being safety or security. So most humans have it on some level. When you put drugs and alcohol on top of it, a lot of times that really suppresses the original trauma. So we don't really see it until somebody gets sober. We can really see a lot of that anxiety and that depression and that up and down show up a lot more in early sobriety. We also have some other trauma modalities. We offer TRE here as a breakout group. That is a lot of the tension release. So really connecting more with your body, because again, we know trauma is stored in the body. Body keeps a score. There's a book out on it. So we know that. We also have recovery yoga. Yoga is amazing for grounding and amazing for reconnecting with yourself and your breath and really tapping into what you are feeling. We also just hired a yoga nidra contractor here that we're going to start, that we're very excited about. That incorporates the meditation practices along with the body awareness practices as well. So, and then I do SE. So I'm going to be opening up myself, actually starting in about a week, to be doing some individual SE sessions here.
Awesome.
That really targets the nervous system and can give a lot of relief, as far as being able to sit with how you're feeling without freaking out, for lack of better terms.
Right. So we're given, a lot of different options, it sounds like, and whether it's in a breakout group or just maybe a quick individual session, not one size fits all, which I guess is a takeaway for me too. What works for one may not work for someone else. And all of these are tried and true methods. It's what's going to resonate and really though connect to get some of these folks over that initial hump in the first 30 days of their sobriety. I know you mentioned SE specifically. Is there anything that you want to elaborate on there for those of us that aren't totally familiar with it? Like what would, if you want to quickly walk us through what that would look like, I would be interested in knowing.
Sure, I've been waiting.
Okay, good.
So the SE approach really focuses on the individual's nervous system. So like I said earlier, we're getting away from focusing on the brain. We don't want to keep retelling our traumatic story, because what that actually does, it re-traumatizes the body. It doesn't work.
Mm-hmm.
So for the SE approach, what we would do in this setting, mainly start out with what's called orientating. So it's being able to look around the room, noticing what stands out. We really want to build on a strength-based approach. So noticing something positive, so something that gives you a good feeling, something that you like. And then we guide the client to notice where they feel that in their body. So again, we're reconnecting with the body. Some clients can't, and that's okay. So sometimes it takes some time to be able to track. If they can, then we just kind of sit with it. We sit with it and we just allow what's going to come up for that patient. All too quickly, we want to jump in and fix and find these solutions. And it's just not effective for trauma counseling. It's not to be rushed through. It is not a progressive phase where it's like goes in a line where you're getting better this way. It's more like up, down, sideways, this way. It's all over the place. And everybody's nervous system is different. So I really get to know the patient's nervous system, what they can sit with. And typically what happens if they're sitting with a good feeling for a minute, a pendulation happens. And the pendulation is, and this is, most people do this, so you'll probably start noticing when you talk to people that they tend to pendulate between something good, then all of a sudden it's something bad. So it kind of shifts. So something good and then something kind of uncomfortable. So we allow that patient to pendulate. What is it like to have that good feeling? Where do you feel it? Let's sit with it. Let's see what comes up next. Oh, now I'm starting to feel some discomfort. Okay. Are you okay to sit with it? Let's see what comes up next. Let's sit with these feelings and these emotions instead of trying to stop them. Because what most of us are primed to do is we love the good feelings, but the ones that are uncomfortable, we always typically we're primed to suppress and avoid. We don't want to do that anymore. We want to allow with whatever arises to come up without attaching a judgment to it, because they're just emotions and they serve a purpose. So allowing that to come up, because then that energetic component of the emotion is allowed to have a voice and it's allowed to release. If you suppress, that actually gives that what we call a negative emotion. I personally don't believe there's any negative or positive emotions, but for layman's terms, a negative emotion, if we keep suppressing it, it actually makes that emotion stronger. It needs to come up through the body. So that's the basic of SE. It's very, very in-depth. I mean, the training is a 3-year training. So that's just very beginning stages. And really the goal is for all the trauma therapies, whether it's EMDR or SE or ART, is really just to be present with that patient, with their own body, with their own nervous system, without attaching a judgment or a reactivity from it. Just being present with them. And I think that's something that all of us need sometimes. Just to be
yeah. Well, I'm learning a lot. This is actually really, really helpful for someone like me. This is fascinating, and we're lucky to have you on board to be doing this stuff, because like I said, this is a crucial, really instrumental period that we're working with these individuals, and have these types of resources it's so valuable. I guess I have one more thing before I let you go. We are, historically really involved in sand tray therapy. I know you didn't mention that, and I think there's good reason for why we're not doing it today. I know we've done individual sand tray, and then we were one of, I believe, the only places that I've heard of that was doing group sand tray. So I know because of COVID, we have put that aside for good reason. We can't really be sharing items, and how that's come to be in that type of therapy. For those that aren't familiar, sand tray is highly experiential in using an actual tray of sand and using different objects, and it's highly fascinating and effective. But we wanted to maintain some social distancing and practice proper sanitation and hygiene on the unit. So my question, any plans on bringing it back, or is this something that we're gonna keep off our plate for now?
Yes, we are talking about bringing it back.
Okay, good.
Focused by Tamara, our clinical director, yesterday. We're trying to work out some, for lack of better words, we're trying to work out where we can fit that in our program right now. This is really what it is. We have a lot of different modalities, a lot of different breakout groups. Tray is, we were doing it as a group breakout group, and it's pretty long. So you're looking at an hour or two between, setup and cleanup. And again, everything needs to be sanitized. So we are working on it. I don't have an exact date, but it is something that we are looking to bring back into our program. Yeah.
Okay, good. That's a personal favorite. I've had the pleasure of being able to sit on a couple of those sessions, and it is, it's moving. It's powerful to see the reaction. Not to say that all of our other modalities are not, but that's one that I personally had like I said, the privilege of sitting in on, and it was very interesting, very eye-opening. And I know our patients respond well to it. So I was just curious. I understand it's a process to bring some of this back, and as we move hopefully out of the COVID world someday soon. Well, that was really it. And I so appreciated this. Like I said, this was highly enlightening for someone like myself. These are some of the things and the words and phrases that you used really resonate with me. Specifically how trauma therapy is not a straight line. That's one of my big takeaways today. It can be a circle, it can go up, it can go down, and that's really important to keep in mind too, as we as professionals approach this, but also for our patients to understand that too. There's going to be the highs and the lows, and that's all part of the process. It's all part of the healing. It's not going to be perfect, and it's not going to be quick. So anyway, I thank you so much. And thank you all for tuning in. We really appreciate it. And we will see you on the next episode of the Recovery Roundup. Bye.